So mobility, flexibility of your muscles and joints. So as a physical therapist, that's what we do all the time. We're always analyzing someone's movements, someone's ability to function, and modifying what we need to modify and improving what we need to improve. We are comparing normal range of motion values. Someone's left, if they had shoulder surgery on their right side, I'm looking at their left shoulder. As long as someone has a healthy left shoulder, I'm looking at their left shoulder to see what their normal is. There's always going to be discrepancies left to right, front to back. We are human. We have specific movement patterns that we have developed over, some people over 90 years. Right hand dominance, left hand dominance, right foot dominance, left foot dominance. It just depends on how people move. So if something's not completely equal on one side, that is very common. We do our best to try and normalize or try to equal everything out, because where there's imbalance, that usually leads to some sort of symptom, right? Some sort of pain or tingling or something like that. Some sort of pathology, I guess, is what I'm looking for. But it is very common to not have things equal on each side. We just need to get it as close as we possibly can to try to level everything out. Again, interventions, yoga. I really like yoga. I was one that was like, yoga is kind of like these weird hippies that do it. But when I started doing it, I was out in Denver, Colorado, and I really enjoyed the workout that came with it. It's not just a mind body thing. It's definitely a workout. Shoulders, hips, legs, core, the whole nine. You can get stronger and definitely move more efficiently and move better with yoga. And then there's stretching. There are a few different types of stretching. There's static stretching, 3 times for 30 seconds. With the static stretching, I prefer, if your goal is to improve your range of motion, this is what you're going to want to do. This one and PNF stretching. So with the static stretching, I recommend 2 times for 1 minute starting off, and bumping that up to 2 times for 2 minutes, or 2 or 3 times for 1 to 2 minutes, so depending on the person. That's the parameters for that. The reason being, you want to think of the tissues in your body like Laffy Taffy. Someone after total knee replacement, someone with frozen shoulder, someone we're really trying to improve the range of motion. I have them do these little low prolonged stretches to improve the tissue's extensibility. Thinking of the tissue like Laffy Taffy, where you go to pull Laffy Taffy apart quick, it doesn't necessarily pull apart. But if you pull Laffy Taffy apart nice and slow at a low load, you're really not trying to stretch the crap out of it right away. The Laffy Taffy extends out, and it usually maintains most of that stretch that you provided to it. Same thing with the tissues in our body, especially with frozen shoulder, total knee replacement, ACL reconstruction, ankle surgery, anything like that. Really lowering the intensity of the stretch to the point where it's a low to moderate discomfort, and then holding that stretch for 1 minute to 2 minutes is going to be important to improve that mobility. Someone with a healthy joint, if they're just stretching just to improve their extensibility, same thing. Always preferring the 2 to 3 times for 1 minute each versus 3 times for 30 seconds. I'm not sure why that's a thing, but 30 seconds is always picked. It's kind of like the strength training 3 sets of 10. Do you even know why you're prescribing 3 sets of 10? And then we'll go to the PNF stretching. You'll see athletes using this before games, where this is okay to use before activity because there is some muscle activation. It's not total static stretching. So this one can also be used to improve the tissue mobility as well. So there's the hold, relax, there's the contract, relax, there's the contract, agonist, contract, relax. So it's all fancy terms of, you're stretching the muscle, you're activating it against the person's shoulders or against the belt, and then you relax it to stretch it again. There's a couple of different variations to that. So the static stretching, the PNF stretching are both strategies that you can use to improve the tissue's mobility. The static stretching not being one that I would suggest you use before activity, before you work out, before you hike, before you hunt, any of that. Afterwards, that's fine. But beforehand, not so much. You want to maintain the tissue's elasticity, and when you And when you statically stretch like that, the tissue starts to lose the elasticity, which then reduces your mechanical advantage. Let's see, we have dynamic stretching. So this is movement based. This is like your jumping jacks, your high knees, the karaoke stepping, the open and close the gate with your hip. For your moving, you're getting your heart rate up, you're improving or you're increasing the tissue's temperature. Therefore, you're going to increase the tissue's elasticity and decrease your risk of injury. And this should be the type of stretching you do before you work out. This should be the type of stretching you do before you go hike, before you pack anything in, pack anything out, before athletes play a game, before they practice. Like, this is the stretching to do. This stretching has shown in research to reduce chance of injury, not the static stretching, despite the fact that static stretching has been around for so long and it's been used so much, but that type of stretching is not shown to reduce rate of injury. And then there's the ballistic stretching. This is the fourth type of stretching. This stretching should never be used. It is going to your end range of motion where you feel a stretch and then bouncing into and out of the stretch again. This is actually shown to increase injury rates. It's not good for the tissues to really bounce into and out of the stretch. It looks like, yep, that's it. So I just wanted to highlight balance and mobility tonight. So anyway, again, I hope you guys have a wonderful evening. We will talk to you on the next podcast.